Well, good evening and welcome to the Chris Howe Foundation's Know Your Status event tonight. This is our first virtual event, but we've been doing the Know Your Status event now for the last 5 years. We have a great program lined up for you tonight. Tonight, we're going to be talking with you about HIV and its continued impact on our communities. It's very important that we have this discussion tonight because while we're in the middle of a pandemic, we still are seeing HIV numbers continue to rise throughout our community. I'm excited about tonight's guests. Tonight, we have several guests who are going to be with us tonight. On with us live tonight is Lynetta Wilson. She's she's a licensed social worker, first of all. Let me say that. She's a licensed social worker. And then she's the HIV end of the epidemic there in Tarrant County coordinator. She's going to be talking more about the work that she does on a day-to-day basis there in Tarrant County. So we're excited to hear from her. Also in our pre-recorded interviews tonight, we have Dr. Philip Wong. He's the director of Dallas County Health and Human Services. He's going to be speaking to the work they're doing there in Dallas County. We also have Edgar Gonzalez, who's with Project Impact. That's a program out at UT Southwestern. And that's a program they have that's geared toward ending the HIV epidemic as well. We're also going to have a condom demonstration for you tonight. April Brown, a longtime volunteer with us, is going to be doing that condom demonstration. So make sure to stick around for that. We also have Edith Lewis, who's going to be sharing her personal story tonight, talking about how she contracted the HIV virus and the stigma that's associated with it. So we have a great show lined up for you. If you have never heard of the Chris Howe Foundation, we are an organization based in Dallas where our goal is to strengthen individuals and families in the areas of health, wellness, and financial literacy. And this HIV initiative falls underneath our health initiative. We're doing this tonight also in observance of National Black HIV/AIDS Awareness Day, which falls on February 7th. It's February 7th of every year. And oddly enough, it always falls around Super Bowl weekend. So many times National Black HIV/AIDS Awareness Day is overshadowed by the Super Bowl. That's the reason we're talking to you tonight on Thursday and not on Sunday, the actual day, because of course this Sunday is Super Bowl Sunday. But you know what? I would hope that the information that you would receive tonight will be information that you will take to any Super Bowl parties that you may be attending, whether they be virtual or in person. I would hope that you would find a way to remind those in attendance that it is National Black HIV/AIDS Awareness Day. And while we're experiencing a pandemic, we're also continuing to experience an epidemic that's ravaging our community, and that is HIV/AIDS. So as we get into the conversation tonight, Lynetta, again, welcome. Thank you so much for joining us to be a part of this conversation.
Thanks, Chris. I'm excited to be here.
Absolutely. So Lynetta, as we get into it, and I think I've just butchered your title there. So let's first of all back up for a second and let's tell the folks exactly what your title is and the work that you do on a day-to-day basis there in Tarrant County at Tarrant County Public Health.
Yeah, so like Chris said, my name is Lynetta Wilson. I am a licensed social worker, and I'm the Ending the HIV Epidemic Coordinator at Tarrant County Public Health. So in my role there, it's just to head up this initiative. We've got some ambitious goals, and my job is just to coordinate community to create a community actionable plan so that we can do some good work to end the epidemic in Tarrant County.
Absolutely. Well, Lynetta, again, your job was created in part due to the fact that Tarrant County is one of many counties in the nation that signed on to become a part of an initiative to end the epidemic by 2030. Let's talk a little bit about maybe some of the initiatives that you guys have set forth there in Tarrant County and how you guys plan to go about carrying those out even throughout this pandemic.
Yeah, so Ending the Epidemic Initiative is a federal initiative that was actually announced in 2019 when the president and his administration just noticed the disparity in 57 geographical areas that are just really struggling with the heavy burden of HIV. So the goal is to reduce new infections by 75% in 2025 and by 90% by 2030. So again, super ambitious goals, but we believe that the time is now and that we have the tools to do so. So very, very similar to what the federal goals are and how we think we can go about ending the epidemic. In Tarrant County, we're focused on 4 pillars, and that's diagnose. We want to diagnose all people with HIV as early as possible. By treat, we want to treat folks who have been diagnosed with HIV rapidly and effectively so that we can reach viral suppression. Our 3rd pillar is prevent. We want to prevent new HIV transmissions. And then 4th, we want to respond to the potential outbreaks that are in our communities.
Yes, yes. You know, when I talked to Dr. Philip Wong earlier this week, and he talked about maybe a lot of the same things that you talked about. He talked about this Achieving Together plan, where it's increasing the proportion of people living with HIV who have been diagnosed to no less than 90%. So again, that's 90% of the folks who are living with HIV knowing their status. And then the other one was increasing the proportion of diagnosed people living with HIV on antiretroviral therapy to no less than 90%. That's again, like you talked about, getting folks into treatment. The other thing is increasing the proportion of diagnosed people living with HIV on antiretroviral therapy who have suppressed viral load to no less than 90%. Again, reducing that viral load. And then reducing the number of Texans with new HIV infections by half. So it's all part of, really, I say Dr. Philip Wong, of course, he quoted that, but that is all part of the 90-90-90 numbers that are part of this 2030 plan. Is that correct?
So those are the 90-90-90-50 goals, and that's actually through the state. So the Achieving Together plan is our statewide plan to end the epidemic. And I was super fortunate to be on the Texas HIV Syndicate and work towards that. But yeah, so there's several different plans that our communities have, but all of them focusing on the same goal of ending the HIV epidemic by 2030.
Yeah, thus achieving together.
Absolutely.
All right. You know what? I want to play this video from Dr. Philip Wong. David, if you'll please roll in that video from Dr. Philip Wong.
And so there's strategies that we want to, prevention. So preventing people from getting HIV, there's now PrEP and medications that people can take to prevent getting HIV. There's rapid linkage to care. That's getting people, increasing testing so people know their status and get tested. And then rapid linkage to care when someone's diagnosed to get on treatment. And then retention, re-engagement, and viral suppression. People who know their status, but then maybe get lost to treatment. And so we want to try to get those people back on treatment and then virally suppressed. And then the other thing that we're looking at is really trying to address the stigma that is associated with HIV, because that really is a barrier to everything. And then, looking at the populations that are most affected, we really want to be, with community partners at the ground level who can, not do the same things, but really reach out and work with the people like we're talking about, community health workers who come from the community that can really identify and relate to the persons that are testing positive.
All right. So Lynetta, again, that was Dr. Philip Wong. And as you can see, he was out at Texas Motor Speedway, where he's also continued to lead the effort, of course, against COVID-19. But I guess I want to ask you, Lynetta, what was the significance? I guess when the federal mandate that came together and put this thing together, say by 2030, what's the significance of 2030?
Yeah, so most of our goals, and mostly like the national strategic plans and then goals and plans in the past, and all these initiatives to reduce the number of HIV infections, normally have that 5 to 10 year time frame. And by 2030, we just feel like, again, biomedical advances are there. Science has shown us that folks who are taking their HIV medications are getting to viral suppression, and U equals U, right? So 2030 just allows us time to get our activities in line, get our communities together and pull them together so that we can really focus, have time to focus on using these biomedical advances to getting to those goals.
Okay. So, of course, when we put this plan together, we didn't foresee COVID. I guess the question would then become, how do you feel COVID has impacted you all in terms of reaching the goal there in Tarrant County?
Yeah, so COVID has definitely impacted all of us, I'm sure. And on the planning side, I feel like it's allowed us to become more creative. So some of our work groups were able to meet after hours. We've all been meeting virtually, right? We've been able to kind of pull in some new community voices that maybe not traditionally be at the table. Maybe it's folks who normally work during the day and weren't able to come to our meetings at the health department, but they were able to tune in through a Zoom meeting or a virtual meeting and things like that. So we also did see some decline, right? So some of the folks who were dedicated to this work and still are, some of their focuses had to change because of their line of work. So we're happy to welcome them back into the fold when COVID subsides. So definitely some challenges, but definitely some positive things too.
Yeah, good deal. And it was encouraging also when I spoke with Dr. Wong earlier this week. He talked about the fact that really COVID, in some cases, COVID has allowed them to enhance their treatment. Let's go to Dr. Wong's video to talk about the treatment there in Dallas County. Well, certainly, I mean, we look at your background and know that, again, we've got a lot going on with COVID-19 right now. So the question then becomes, do you see COVID-19 as an interrupter in terms of those who may have been receiving treatment and now maybe because of what the different changes that have taken place may have caused them to lapse in that treatment?
Well, you know, I mean, definitely COVID-19 has been affected everyone. It certainly affected some of our ability to do some of the activities, but we really still have quite a few things that are continuing to move on with this. I know our own sexual health clinic started offering PrEP at the clinic. We're working on, you know, rapid linkage to care with our community partners so that as soon as we identify persons with HIV, can really immediately get them on treatment. Used to be you tell someone, oh, you tested positive, come back in 3 weeks or something, and we'll talk to you later. But now we can almost say, well, you tested positive today, but I can get you started on treatment immediately. And in a couple months, you can be virally suppressed and actually have like a normal life.
Yeah. So again, that was very encouraging to hear that, again, even during COVID, Dallas County Health and Human Services could actually step up and continue their outreach. So our thanks again to Dr. Philip Wong for taking time out this week to speak with us, even there while he was at Texas Motor Speedway battling against COVID-19. So Lynetta, as we continue this discussion and we talk about the things that you guys are doing, let's talk about some of the prevention efforts. I think, you know, again, when we talk about prevention, one of the things that always come to mind, of course, are condom usage. Talk about maybe some ways that you guys have thought about maybe continuing to distribute condoms or make folks condoms accessible to folks there in Tarrant County.
Yeah, so at our public health department, we are fortunate to work with a great team of community service aides who are really active in the community and have built some really good relationships. So we're able to distribute condoms at local barbershops and hair salons. We've got several other community partners, colleges and things like that, where we're able to get condoms to. We've offered it to our folks who work with our intimate partner violence in that sector. But again, just like you said, we just had to become really strategic on how we get it out to the community, since COVID hasn't really allowed a lot of folks to come in to see us. Folks can also call and make an appointment, and we're happy to do prevention testing, STD testing, as well as providing folks with condoms and those condom demonstrations like we talked about.
Absolutely. You know, I think that's extremely important because it's one thing to give the folks the information. One of the things we've always strived for here at the Chris Howell Foundation is, we want to give the information, but we also want to make sure they have the tools to be able to act accordingly once they actually get, once the moment presents itself, that they have the tools to be able to do it. So we do the condom demonstrations as we put on our health and wellness fairs when we could, but that was pre-COVID when we could actually go into the community, set up in like a gymnasium or something, and then we conduct all types of testing, whether it's high blood pressure screenings, dental exams, eye exams, things of that nature. And then over in the corner, we would have the HIV testing because, again, and we'll get into it a little bit more later, the stigma that's associated with testing. Many folks didn't even want anyone to know that they were being tested. And then sometimes they would sneak over in the corner and say, hey, those condoms that you guys talked about, can we get a few of those condoms? Because it's just something about stigma that's associated with sex. And I guess as much as we all want it, we don't want to talk about it. So they would be reluctant to even ask for condoms. But so we want to make sure that we actually can still get those to folks, particularly in the time in which we're in now, because we're seeing numbers continue to increase even in the middle of a pandemic. Will you speak to, I guess, maybe what you guys are seeing there in Tarrant County, whether it relates to all STIs, not just necessarily HIV, even during the pandemic?
Yeah, I think what I would say to that is even during a global pandemic, people are still having sex, right? We can't change behavior. And so one of the things that we pride ourselves on is just still offering those free HIV testing, gonorrhea, chlamydia, syphilis. So folks, again, can make appointments with our agencies and other agencies within the community to make sure that they get tested so they know that where they stand, not only with HIV, but all those other STIs also. So again, I would just reiterate that COVID has not changed behavior. People are still engaging in sexual behavior and people still need to access testing. And my hope is that after this, folks know where they can do that and that they can do that and that they should.
Absolutely. And not just where they can do it, but we also want to make sure they know how to do it. So what we're going to do now, we are thankful to a longtime volunteer of ours, April Brown, who came in to actually put together this video to show you how to properly use a condom. And some folks may assume that, we really have to show folks how to use condoms. you would be surprised at the number of folks who really don't know how to properly use a condom. So thank you to April Brown for doing this. Take a look at this and we'll be right back.
I'm April. I'm going to be doing a condom demonstration for you all today for the male and the female. Yes, ladies, we do have a condom. Okay, so let's jump right into it. We're going to start off with the male condom. There are two important facts here when opening up your package. First fact is important is to make sure you check the expiration date on the package. You want to make sure it's not expired, okay? And when opening up the package, you want to make sure you're ripping it along the lines that is there for you. So, proper placement, okay? When you open up the condom, you're going to see there's a pocket at the tip. To put it on, you're going to know that having that tip at the top is going to be the proper placement to put it on, okay? So you want to put it on your penis and you want to roll down. And yes, we do have men and young men out here that does not know how to properly place a condom. The most important fact is if you put it on improper, you have to take it off and start over. But you cannot use the same condom. You have to start over, okay? Because now you have contaminated the condom. So once you're finished, you want to roll it up, take it off, and drop it in the trash can. Yes, the trash can, not the toilet, because you don't want to stop up the toilet, okay? Throwing it away in the trash can is important. Now let's just dive into the female condoms, ladies. Important factor, check the expiration date. You want to make sure you don't use a condom that's expired, okay? So you're going to check your package. You're going to wiggle it around. Make sure it's lubricated. Make sure it's not dry, okay? And when you're opening up the package, there is a spot on your package that will show you where to open the package. No fingernails, okay? Just rip it open. You take it out of the package. And once you take it out, it's made like this, okay? On the bottom, there's a ring. There's a ring on the bottom of it, okay? You're going to pinch it off and you place it in. And that ring will settle at the bottom. It'll settle just on the bottom. When you're putting it in, be careful with your fingernails so you won't put a hole in it. I know I've said that already, but I just want to make sure you get that. Remember that it's important not to puncture the condom. So, but once you begin to have sex with the male, he will be able to push it in and it'll further down, float down into place and settle on your cervix, okay? You want to make sure you're covering your outside of the vagina with it. No, it's not going to tuck around on you, but I just want to show you, to remind you to make sure you're covering it, be protected on the outside as well, okay? And remember, you can't put this condom on up to 6 hours, so you can put it on at home, go on your dinner date, be in place and already be ready to have it on for your protection once you are there with the male, okay? Once you all are complete, you're going to take it off, twist it around so that when it's coming out, you want to make sure none of the semen is coming out to still go inside of your body to prevent pregnancy as well as STDs, HIV, and AIDS. And you just want to twist it off and you just throw it in the trash can. And that's it. Now I'm going to go back over those facts for the male as well as the female. Expiration date, number 1, proper placement, as well as no puncturing holes inside of the condom.
All right. Our thanks again to April Brown for doing that. Really appreciate her. And again, if you missed any part of that and want to make sure that you can slow it down and rewind it and all that good stuff, all of this will be available on the Chris Howe Foundation website. That's chrishowefoundation.org. We'll have this up for you tomorrow. The entire program will be there on the Chris Howe Foundation website as well. In fact, actually, I think the portion of that video is already on the website. David, if you could put up that graphic that Chris Howe Foundation / Know Your Status 2021, they could go and take a look at that there. So while David puts the graphic up, I want to then ask you, Lynetta, we talked about condom usage. We've talked about and shown them how to properly use a condom. But I think the challenge many times is how do we approach that conversation in terms of condom usage? So how would you encourage women specifically to approach the conversation on using condoms with their partner?
Yeah, so I would just first say that regarding Tarrant County, 1 in 222 Black women are living with HIV. And we really want to decrease that number, right?
Yeah.
And with the hopes of ending the epidemic, my just desire is for people to know that, especially with Black women, and when it comes to diagnosing, most times they are diagnosed from sexual behavior, right? From just unprotected sex with a male. So having those conversations, consent, and talking about those things prior to sex are important. I know sometimes we're not able to get condoms or to use condoms. So maybe it's a female condoms. Maybe a male partner isn't willing. So maybe we make sure that we have access to female condoms. And again, there are tons of places in the community, in addition to the health department, that have those free for folks. I would say another way to do that is protecting yourselves by using PrEP. And I know that we're going to talk about that later. But those are the two things that I would say. Is just recognizing that Black women are at risk. Women are at risk, right? And that the conversation and negotiating those terms are very important when we're talking about sexual relationships.
Absolutely. And you know what? I think one of the things that, when you hear conversations like this that are taking place, I think it makes it a little bit easier for you to approach that conversation with your partner. It could be you guys have never discussed it, but just say, hey, the other day I heard this conversation on Facebook and they were talking about the importance of condom usage, things of that nature, and then get your partner's perspective on that. And that allows you to be able to open the door to be able to have that conversation. I think it's extremely important. And, I thought about this as you were talking. And one of the things, the beauty of this, of doing something live, is you can just ask for something. I'm going to ask someone to bring me a dental dam from the other room, because I want to be able to show a dental dam, because we're talking about condoms. And I think it's also important to note that we still have the older generation, as well as that younger population, who believes that oral sex is not sex, and disease or viruses and the diseases are being contracted because of oral sex. And I think talk a little bit, if you will, about a dental dam, as I get someone in the other room to bring me a dental dam so I can show it online, because many folks are like, what is that? I've never heard of that.
Yeah, that's so true. We get tons of people who come into the office who aren't aware of a dental dam, or maybe they haven't seen a female condom too. So a dental dam is a protective barrier that helps with transmitting of viruses and things like that during oral sex. So a lot of people say it reminds them of colorful saran wrap. So.
All right, good deal. And Dominique Jr., thank you so much. Okay, so I'm going to try to do as best I can here. I'm not April Brown. I'm not as good at this as she was, but I think it's important for you to see this, because again, when you go to talk about condom usage, this is, I guess, a mint flavor. If you could see that there, it's a mint flavor. But again, as Lynetta pointed out, it just becomes a barrier that you can use during oral sex. And I guess for those older folks like me, I don't want you to mistake that for a fruit roll up. That's not what that is. While it may be flavored and all that, that's not, but that is a condom for oral sex. And again, it is called a dental dam. Lynetta, you alluded to it. Let's talk about it a little bit more. That is pre-exposure prophylaxis, or PrEP. PrEP is a way for people who do not have HIV, but who are at high risk of getting HIV, to prevent HIV infection by taking a pill every day. So we now know that PrEP is a pill. Lynetta, talk about what your knowledge is regarding PrEP.
Yeah, so just like you said, PrEP is a medicine for people who are at risk for contracting HIV to take it prior to take it so that they don't contract the virus. PrEP does have to be prescribed by a provider, and PrEP is easy to access regarding costs. I feel like a lot of people kind of hear PrEP. We see the commercials. Sometimes we hear it in some of our shows. We're like, how do we get that? And we can put some resources up on how you access PrEP. Again, PrEP does protect folks from contracting the virus, but that doesn't mean that you don't get to use condoms, right? So right. Although it protects us from HIV, it does not protect us from the STIs that come along with it. So just like being on any medication, you want to make sure that you're following your doctor's orders, you're making your appointments regularly, you're having labs taken, and making sure that you're allowing your doctor to monitor your progress. And you also want to make sure you're taking that medication every single day.
Yeah, good point. Good point. And you talked about the fact that, again, we still have to be mindful of the other STIs, because, again, we're talking a lot tonight about HIV because, of course, we're doing this in observance of National Black HIV/AIDS Awareness Day, which is this Sunday. National Black HIV/AIDS Awareness Day is February 7th of every year. It's in its 22nd annual observance here this coming Sunday. We're doing it tonight because, of course, it would be overshadowed by the Super Bowl on Sunday. So we're talking tonight. So, Lynetta, you talked about the other STIs. While we were talking about HIV, we also know are mindful of the fact that chlamydia, gonorrhea, and syphilis are also on the rise, really across the nation. But certainly we're seeing its impact here in North Texas as well.
Yeah, I mean, you said it. People, again, we mentioned it earlier that folks are still having sex. And unfortunately, when we're doing it without protection, we're leaving ourselves more susceptible to those things. And we definitely are seeing that. So it just goes back to making sure that if you are engaging in risky sexual behaviors, that we're testing for all the things so that we can make sure that we're treated and that we're not passing along those things to other partners.
There you are. Good deal. Good deal. Lynette, I want to ask you and I guess you want to invite you to send a question. If you've got a question, certainly feel free to send it to us now via Facebook. We'll get those questions and we'll work them into the conversation. This is an interactive conversation. Also chime in and let us know where you're actually viewing this from. I know while we're based in Dallas and Lynetta's in Tarrant County there in Fort Worth, we still know that folks are observing this from around the country, possibly even around the world. Just if you will, just in the comment section, note what city you're actually viewing this from. We would greatly appreciate that, just so we have a sense of where you're viewing from. Lynetta, someone says, does Texas health officials offer at-home testing kits for folks to actually get a testing kit at home? Is that something offered by your office?
So that is not done at my office, but is definitely done in our community. And I'm so excited that that was a question that was asked. It's on my resource list to share in the comments after this is over. But yes, there are several agencies in our community that do offer at-home testing, and we encourage it, right? Like, again, you mentioned earlier that stigma is a thing, and sometimes folks might not be comfortable walking into a clinic to be tested or at a testing event or at a health fair, but maybe they want to test at home with their partner. That's an option too. So my suggestion would be, and again, I'll link, I'll put some comments in the link, but there's a website you can go to where you can request an at-home test. They'll mail it to your home discreetly. There's instructions in there. There's resources in there so that you know, like, regardless of how that test reads, if it's negative or positive, folks have access to the care that they need after that. So maybe if the test is negative, then they know where to go to get PrEP, if that's an interest. If the test does read positive, then they know where to go to make sure that they can access services, access care, get on medication, and get to undetectable.
Man, good stuff. I was getting a note here and I didn't hear, did you say you have that link available now or you know it? Because if you call it out, we can get someone to type it in, or do you need to get it later?
No, I can, it's www.takemehome.co.
Okay, good deal. One more time. I thought I saw that in the chat here somewhere. Give it to us one more time, Lynetta.
Sure. www.takemehome.co.
All right. www.takemehome.co. Kimberly, if you could place that in the comments, that would be great. Okay, Lynetta, I have got a note here that says, have Lynetta to state the HIV stats for Tarrant County. Do you have those readily available? Or we can place them on our website?
Yeah, we can definitely place them on your website. I think I sent them. Currently, off the top of my head, I know there are about 6,400 people living with HIV in Tarrant County. We are waiting on current data. I hear that it's available from the state, so that should be coming soon. So the data that I will share that we can post is 2018 data. I do want to be perfectly clear and transparent about that, but we are waiting for brand new, hot off the press data. And when we get that, I'll make sure that we share that too. Okay.
And let's I guess, clarify that, because the state generally runs, about a year or so behind on the data?
So 2 years, and we're dealing with COVID, so.
A little bit longer.
Yeah, so we were hoping to have it last summer, but of course, COVID. So we'll get it soon, and we'd be happy to share that information with you.
Okay, good deal. Good deal. Oh, you talked about stigma. Let's, I think stigma is one of those things that becomes a barrier to really ending this epidemic, because again, it prevents folks from being able to share their status. It prevents folks from going to get tested. Like I talked about earlier, it even prevents folks from even wanting to receive condoms because of the stigma that's around condom usage or even with being tested. So I think it's a huge area. What are your thoughts regarding that?
Yeah, stigma it's hard because there's all sorts of things that bring stigma. Maybe it's it's culturally, right? So maybe it's the way where you were brought up. Maybe it's stigma within your family if you are living with HIV. I was a case manager prior, and I heard many patients, talk about having to eat off separate plates and forks and things like that, just because folks don't know, just because people just aren't aware and aren't educated. We are super fortunate at our entity and our agency to have a Rethink Positive, which is a stigma campaign where my colleague is able to go out and really just teach people about stigma and how to reduce stigma and really just educate community on those things. So stigma is definitely real, and it does prevent people from getting tested, but it also prevents people from getting in care. And I think a lot of that just stems from lack of education and knowledge.
You said it best. I really believe it's just ignorance, and it's again the lack of education, which is the reason why we do things like this. Try and have the conversation in hopes that we can educate folks better. In hopes that if they do happen to have a loved one or someone who does test positive, they can then wrap their arms around that individual and give them the love and support and care that they need. Because again, my brother passed away due to complications of HIV and AIDS in 2006. He was 33 years old, and I share the story all the time on how really when he first contracted the virus and shared with us that he had the virus, again, we wrapped our arms around him and showed him all the love and support that he needed. But then when he began to show symptoms and really began to get sick, things of that nature, that's when we began to shun away. And unfortunately, that's when he probably needed us the most. And I think, while he lived for 12 years with the virus, I think had he had a good support system, he probably could have lived a little bit longer. So part of our reason here at the Chris Howell Foundation, in terms of really just being in your face with the messaging and things of that nature, is because, again, we want to educate people as much as possible to ensure that you have the information that you need to be able to properly care for a loved one or someone else that who may become positive. I have a very good friend, Edith Lewis, who has been positive now for probably about 23 years, I would imagine. Edith and I did an interview back in 2015, and Edith talked about her status and how she contracted the virus. And it was actually during that interview with Edith Lewis that I learned about National Black HIV/AIDS Awareness Day. Had no idea of it prior to that. And when she shared that with me, I thought, we really need to rally around that day and really continue to do something about it. So I want to share this interview with Edith with you, just so you can hear how she contracted the virus. And again, how she talks about, even in her situation, how she had fell into the trap of maybe believing some of the myths associated with HIV and AIDS as well. Take a look at this. We'll be right back. You met your husband in church. Mm-hmm. We're sitting today talking to you in another church home.
Yes.
So obviously you have maintained your faith throughout this process. Many folks would probably become mad at the church, mad with God. I met a man in church. I thought there was no way this could happen to me. What has allowed you to not become angry, bitter, or what have you?
Well, to be honest with you, I was angry with God because in my mind, God is all knowing. He knows everything. Mm-hmm. And so I wanted to know, why didn't you tell me? Why didn't you share with me that he was positive? But when I sat down and I thought about it, would I have listened? Because this man proposed to me. He's going to marry me. And I was excited about that. I probably wouldn't have heard anyway. He may have. I didn't hear him.
So had this man disclosed to you that he was HIV positive, are you saying that you probably likely would have still married him and maybe just practiced safe sex throughout the marriage?
That is not what I'm saying.
Okay. You're
No.
saying if God had disclosed
The Lord.
to you, okay.
We're talking about the Lord.
Yes.
No, had he disclosed to me that he was positive, I wouldn't have married him because I wasn't educated enough.
Yeah.
What I would have done was been his friend. I know I would have been his friend,
Okay.
but I wouldn't have married him.
Had you ever been married before?
No.
Okay. So your first marriage, meet a man in church. You think because you met in church, it's probably pretty safe to let your guard down a little bit.
Oh, I threw caution all the way to the wind. What?
Yeah.
In the cell. I let it go.
Yeah.
I'm marrying a preacher.
Yeah.
In church. I'm in church. I didn't need to know. Well, during that time, I was living off the myth of what was said about HIV. You either had to be a prostitute, a drug addict, or gay. I was none of the above. So I was none of the above, so I didn't inquire.
Yes.
And I went with the flow.
Did you ever, once you all were diagnosed, did he ever disclose to you how he contracted the disease?
He did.
And if so, was he one of the above?
He was.
Certainly grateful to Edith Lewis for sharing her story. Edith Lewis is a strong HIV advocate here in Dallas-Fort Worth. She's also a peer advocate as well, a peer navigator, where she goes throughout the community, helping those who are newly contracted with HIV, getting them into treatment. So Edith, thank you for your work, and thank you again for sharing your story with us. While we were off camera there for a moment there, Lynetta, you actually shared something with me. You want to share it on tape? Or
Yeah, I was just, we were talking about how we had similar experiences as to why we got into this work. So in 2007, my brother passed away, and it was, drastic for me. I was like, healthy 30-year-olds don't just die. So after asking a lot of questions and finding out, I found out that my brother was living with HIV. And that really did change the entire trajectory of my life. I was really angry. I was angry that he didn't tell me and that others didn't tell me that knew. And my therapist actually told me something that changed my life. She told me I had to do something with that anger. So I turned the anger into advocacy. I started getting involved in volunteering. I found employment. I went back to school to become a social worker. So it really is just my desire to educate folks and to help folks living with HIV so that they always know that they have somebody in their corner who's fighting for them, somebody who's there to kind of help them be a light in a dark place. So I appreciate you sharing your story, Chris, because it was very, very similar to mine and why I do this work, every day in my brother's honor.
Wow. Thank you. Thank you. I mean, thank you for sharing your story. And I guess it's really just, again, part of why we have these discussions, because you and I even had a conversation the other day, but I didn't know that because we didn't get into sharing our stories in that way to learn, the similarities that we have in terms of how our lives are connected here today. So thank you for that. Yeah. So as we talk about Edith Lewis in the video that we just saw there, one of the things that Edith Lewis video does, it helps to remind us of the conversations that we need to have with our partners, particularly if you're in a new relationship and you're looking at getting married, things of that nature. Like Edith talked about, she threw caution to the wind. She had met a man in church and, again, fell into the trap of believing that maybe, because someone lives a particular lifestyle, they, wouldn't dare have HIV or any other disease for that matter. So she threw caution to the wind. Lynetta, again, I guess we talk a lot, and I keep coming back to Black women, I guess, because I guess as we're in the community and we're trying to help prepare them to understand how to open up that conversation of being tested, their status, things of that nature, it seems like it becomes more and more difficult for them to do it the younger they are. And in some cases, if they've been off the dating scene for a while and getting into a new relationship, they're excited about the new relationship. They don't want to do anything to cause the man to run away. So they don't want to open up that door to asking them about their status. Again, I'll ask you, what do you think we could do to try to make it a little bit easier for younger women and older women alike to be able to have that conversation?
I think just normalizing testing, just making that just a common thing. If we are participating in risky sexual behaviors, that we are checking up on that, right? We get a checkup for everything else. Like why wouldn't we include HIV and other STIs in that, especially if we're engaging in the behavior?
Yeah.
Another thing just about Black women too is that we're caregivers and we're nurturing and we're expected to just carry the weight of the world on our shoulders. We're taking care of children and families. Sometimes it's generational, right? So we don't always take care of ourselves. So I think just making sure that Black women know that there are people in the community who are happy to connect them and link them to services. I think it's important for Black women to know about PrEP and know that PrEP is affordable. In most cases, people don't pay anything for it. And I think it's important for them to know how to have those conversations in healthy relationships on negotiating condoms and making sure their partners are being tested. Because, even if you think you're in a monogamous relationship, that might not be the case. Your partner might not be, right? So I really do think that we should just normalize conversations like these, which is why I appreciate the opportunity to ever do things like this, just telling folks. And especially when it comes to our younger generations, we can't talk about it much in schools, but we can talk about it at home, right? So so that we're not just ignoring it, so that we're acknowledging that sex happens, and we're teaching our kids how to do that safely, how to protect themselves, and really just how to stop the spread of all STIs and HIV.
Yeah, absolutely. I want to say real quick just to a couple of folks. Someone said online there, Lynetta, we really appreciate Lynetta and her passion for this work. So again, folks really appreciate the work you're doing there in Tarrant County. I thought you should know that. Thank you to the folks who are viewing from Arlington, Paradise, Texas, and Jackson, Mississippi. Thank you so much. Really appreciate you guys for tuning in. And please feel free to share this on your page. And again, it's an interactive conversation tonight as much as possible. I want to ask you all, I asked Lynetta, I want to ask you all, maybe what do you think are some of the ways that we can help to allow younger women and older women alike to feel more comfortable engaging in the conversation around their partner status and asking their partner their status, and then taking their partner to even be tested should it call for that. But again, what can we do to make the conversation just a little bit easier? So if you'll please share your comments, we'd like to maybe share some of those. If you'll get them on there, we'll get someone to be able to pull those and get them to us. Lynette, as we continue in the conversation and talking about prevention, right now we can't even go outside without a mask on. So some folks may be watching tonight and thinking we can't even go outside without a mask. We're in the middle of a pandemic. Why are we even talking about HIV? Of course, folks are not having unprotected sex, but I will tell you they are, according to Edgar Gonzalez, who is with UT Southwestern's Project Impact. We had an opportunity to talk with him earlier this week, and he talked about the fact that they are continuing to test even during COVID. And while COVID has been going on, they actually have seen the numbers uptick just a bit. Take a look at this video from Edgar, and we'll be right back.
From June to December, we opened up a little bit more regular as far as testing in the office. So we are having people come back with positive gonorrhea, chlamydia results, syphilis results, and we have had new diagnoses that we found during these past 6 months when COVID has been at its worst. So definitely there's not a correlation with, COVID infection and decreased HIV cases. Those do not mix at all. I mean, we're just still seeing people that are engaging in unprotected sex, and that's where the STI rate is, it's increasing and it's still there.
All right. Our thanks again to Edgar Gonzalez for that contribution to tonight's program. Really appreciate him. I want to just real quick, while we were off camera there, I had a chance to just kind of look at some of the comments. We asked you all, how can we encourage women to have that conversation? Lynetta, Brian Tyler Orr said, make it a date. Couples testing should be normalized. So I think that's a great idea. We're going to go out on a date this afternoon and, just tell them it's a wonderful place. You guys are going to go and visit, and it's Tarrant County Public Health, right?
Hey, Valentine's Day is coming up. People still have time to go to that website and order a take-home test. They can do it from the safety of their own home. I'm here for it.
Yeah, and Hope Adams says, keep having conversations with friends and family. Make it normal. Okay. Also, while we normalize testing, don't shame someone for being uncomfortable. But be their ally and encourage them to get tested before engaging in any sexual encounters. So again, Brian Tyler Orr, thank you so much, Brian, for contributing to the conversation. So when we talk about testing, one of the things that most folks, as we're in the community and talking with folks about testing, that one of the things they quickly come back with is, I'm at my doctor's office religiously every year, pretty much the same date of every year, and I get all of my tests done while I'm at my doctor's office. And then when we tell them that most of the time your doctor is probably not testing you for HIV unless you specifically request it, they're surprised. Talk about that, Lynetta.
Yeah, I mean, that's true. Some folks aren't asking for testing, so they're not getting those tests. I will say that there are some hospitals in our community that offer opt-out testing, meaning that if you show up at our public hospital here in Tarrant County at JPS in the emergency room, that they're more than likely they are getting tested. Okay. So kudos to folks like that that do have those opt-out testing options. But again, yeah, I would say that when we're going for those appointments to see our providers, our annual appointments and things like that, that we're asking for those tests. I would also encourage folks who work in the medical community that they take responsibility of that too and offering those things. I know that sometimes when I was a case manager and I was seeing patients all the time, sometimes it's uncomfortable to talk about sex, right? But it's still important. It's still important in taking care of the entire person and making sure folks know that that's an option to be tested is important to note also.
Yeah, and you're right. It probably could be uncomfortable, specifically maybe if you're married or something of that nature, and you're asking your doctor to give you an HIV test, and you're thinking my doctor's going to wonder why am I getting an HIV test if I'm married, things of that nature. But again, as we talked about, I think even the CDC recommends that everyone has the HIV test at least once in their lifetime. So if you've never been tested, maybe it's at least getting tested for the first time. But I think it's also if this is your doctor and they know all the things about you already, that's just one thing in addition to that they're going to know about you, the fact that you're looking out for your sexual health as well as everything else. So I think it's okay to ask them to just test you for HIV and any other STIs that you may be concerned about.
Yeah, you're there anyway. Why not get a test annually?
Yeah. It's, I guess, as I keep hearing the word tonight, you've said it a couple of times. Brian Orr chimed in a moment ago and said it, normalize it. Yeah, just make it a normal part of your routine in terms of getting your exams, but don't assume that just because you're getting a physical and your doctor gives you this long list of items that have been checked off to say that we're going to screen you for this and screen you for that. Typically, HIV is not one of them unless you specifically request it or unless it's a facility such as what Lynetta has just described there in Tarrant County. When we talk about getting tested, it's important to know your test status. And the title of this event tonight is Know Your Status, because should you test positive or should someone you love and care about test positive, the reason for getting that notice as quickly as possible is so they can get into treatment. One of the things that Edgar talked about that they are doing there at UT Southwestern's Project Impact is treatment. Let's go to a video from Edgar and we'll be right back on the other side of that.
We do have a program that works directly in linkage. I have 2 staff members that are on our program. What we call it's a peer program. So they are actually living with HIV, and their goal is to help newly diagnosed and people that are out of care get linked into care. And it's a whole process. They'll call the clients, find out what their needs are, and depending on the client needs, refer them directly to a clinic. And during COVID, so HIV care is out there. It is accessible. There are a couple of different things as far as we tell clients that they may need to do that they wouldn't normally do, but there is access to care, and our staff member on occasion does meet with clients there at the facility to make sure that they get linked.
All right. Our thanks again to Edgar Gonzalez, UT Southwestern's Project Impact, for contributing to tonight's conversation. Really appreciate him and the work that they're doing. Prior to COVID, I will say one of the things about those guys, the Chris Howell Foundation is always partnered with them, because prior to COVID, one of the things they would do is folks could call their number or go to their website and request a test, and they would actually come out to the folks' home or meet at work or wherever they needed to in order to test that individual. Now with COVID, they're doing things by appointment only, but we have put a link to their website on our website. If you go to chrishowellfoundation.org/know your status 2021, you'll find several resources that are available there for you. Also, you'll find the link to Lynetta's website, Tarrant County Public Health, as well, to get more information regarding the work that they're doing. So, Lynetta, you talked about it earlier tonight, and I want to actually delve into it a little bit more, because folks are probably now seeing some commercials regarding PrEP and some of the other things that are out there, and they hear the term U equals U. What does that mean?
Yes. So U equals U means that undetectable equals undetectable equals untransmittable. So folks who maintain an undetectable viral load, so we're meaning that somebody who's HIV positive is going to their doctor's appointment, getting prescribed medications, taking their medications every day, and they've reduced the amount of virus in their blood, they are able to have unprotected sex without transmitting the virus. So the science is clear. It's been studied time and time again that undetectable equals untransmittable. And we are excited to see all the U equals U initiatives. We are excited to tie that into our ending the epidemic work so that folks know that U equals U.
Yeah, good deal. So we talked a lot tonight about HIV. Again, I think we talked a little bit earlier about syphilis and gonorrhea. Dallas Fort Worth, of course, I guess a couple of years ago, we saw, and I guess in terms of as it compared across the nation, Dallas Fort Worth was like second in the nation in terms of new gonorrhea and chlamydia cases. And at one point we were even talking about, was it a super gonorrhea?
Yeah, so I cannot speak to the STI side of that. HIV is definitely where my main focus is. But okay, that is definitely true. There is an uptick in those things. And also congenital syphilis is actually, we've been seeing a lot of that. So babies are are contracting syphilis from moms. So definitely something to be aware of. And again, just stressing the importance of getting those tests if we are having unprotected sex.
Yeah. And I think one of the things would happen today when you go to get an HIV test, they are also testing you for syphilis as well.
Yeah, and I believe that's agency to agency, but definitely at the health department, you can come in and get the whole lineup, right? So gonorrhea, chlamydia, syphilis, and HIV. In addition to that, I do want to add, because I think we haven't talked about it much, but some really good counseling. So while those tests are running, we've got some really incredible staff members who are able to talk about those risky behaviors and how do we reduce the risk when we are engaging in sex and other activities. Condom demonstrations like we talked about earlier and things like that. And I really do think that that's a really important piece. A lot of times we focus too on like just a status neutral approach, meaning that regardless of how that HIV turns out, that test turns out, that we have resources and that folks have information and education on what to do. So again, if that test is negative, we have access to PrEP. And if that test is positive, we can quickly link you into care so that we can get you to undetectable, because you equals you.
Yeah, there you go. Talk about how you guys, of course, now that COVID has happened, of course, how are you handling appointments? Should someone schedule an appointment with you all to come in to get tested? How do they go about doing that? And how do you handle the procedure?
Yeah, so the easiest way right now during COVID is to call us and make an appointment so that we can make sure staff is available safely to get folks the services that they need. And I would also like to say that that's probably the case for most of the agencies in our community, not just at the health department, but at the other agencies in our community too. So I will be sure to link some of those groups inside the chat so that folks can click on there and access testing there. But I would definitely say call first during COVID to make sure that they have the capacity to get you in and that you have an allotted time to make sure that you're safe and make sure staff is safe also.
Good deal. Good deal. Talk about the significance of National Black HIV/AIDS Awareness Day and the role that you foresee it playing in helping us to end this epidemic.
Yeah, so National Black HIV/AIDS Awareness Day is really just for us to increase awareness and have conversation like these within Black communities. We know that we're just disproportionately affected by HIV and most things. So it really is great to have a day where we can observe it and talk about things like this and really just kind of, again, there's that word normalize sexual health and normalize getting HIV tested and really just raising awareness about it, like letting folks know that testing is out there, it's accessible in most cases, it's free or low cost. Mm-hmm. So we just do our best to take this time to really just let folks know that we are in it to stop HIV together, which is, I think, is one of the themes this year, and getting folks access to things like PrEP and condoms and just education so that we can end the HIV epidemic.
Absolutely. Absolutely. Well, Anela Wisdom, thank you so much for being with us tonight. You've certainly contributed a lot to the conversation and really appreciate you taking the time on a Thursday evening after I'm sure you probably had a very busy day as you're wrapping up the week to spend time with us on a Thursday evening. We really appreciate you going above and beyond to do it. Our thanks to you as well, the audience, for watching tonight. And many of you have chimed into the conversation. Really appreciate it. We're going to end the conversation here in just a few moments, but it doesn't end online. Continue to share your comments because this will circulate for the next few days and weeks and beyond. And folks will continue to come through and scroll through those comments. And maybe it's something that you share that can help someone else and prompt them to go ahead and get tested and know their status, or get their partner and go out on a date and make it a date night, like Brian mentioned, to go and get tested together to receive their status together. So it's important that any knowledge you have regarding this topic, please share it. Any personal experiences you may have, please share those as well. We look forward to receiving all of that information. And we're still looking for ways in which we can be creative to go throughout the community and to distribute these condoms. We again want to not just share information with you, we want to put these in your hand. So if you can think of some creative ways in which we can go about sharing these, please let us know. We have received thousands and thousands of condoms, and it's not our goal to have them sitting around our office. They're not doing anyone any good sitting around our office. Our goal is to actually get them to the folks who need them. So once again, thank you for being with us this evening. It's been the Chris Howell Foundation's 5th annual Know Your Status event, all in observance of National Black HIV/AIDS Awareness Day, which is this Sunday, February 7th, 2021. And I have my beautiful bride standing next to me as if she wants to tell me something before. So before I completely sign off, I got to ask you something you want to tell me. Oh, she said no. So I have permission to sign off. Thank you again, Lynetta. Thank you folks for watching. Have a wonderful night.